90% of patients diagnosed with interstitial cystitis do not have a bladder disease. In actuality, they have an underlying pelvic floor dysfunction. In this video, I am going to get into why there's so much diagnostic confusion, what the actual causes of interstitial cystitis symptoms are, and how people can effectively get on a treatment plan so they can get relief. To really understand interstitial cystitis in 2020, we kind of have to look at the origin of the diagnosis and how we got here. So Campbell's urology is the gold standard for urologists, and until 1986, interstitial cystitis was classified as a disease of hysterical women, characterized by irritated bladder symptoms. 1986 seems like a long time ago, but actually I don't feel like it is. And so as we started to label this as less of a disease of hysterical women, but it was characterized by irritated bladder symptoms, everybody started to look at the bladder in terms of research, diagnosis, and treatment. As time went on, they found that people who had bladder symptoms didn't necessarily have impairments in the bladder itself. And people who did have impairments in the bladder sometimes didn't have symptoms. So one of the challenges here in 2020 is that many urologists may have heard of interstitial cystitis, and they usually have two thoughts. It's either something that is a hysterical syndrome, a catastrophizing situation, or it's related to Hunner's lesions, which are impairments in the bladder lining itself. Unfortunately, none of these things are true, even though it is the belief of many urologists who do not specialize in interstitial cystitis and other pelvic pain syndromes. The symptoms of interstitial cystitis are characterized by urinary urgency, frequency, pain, feelings of incomplete emptying, and often these symptoms are so bothersome, understandably people go to the urologist. Depending on the scope of knowledge that the urologist has about interstitial cystitis, there may be varying treatments that are offered to patients, such as bladder installations or certain medications such as Elmeron. As we're discussing in this video, if the bladder itself is not the problem for that particular patient, bladder-directed therapies may not be effective. So people keep going back to the urologist, they keep getting tested for urinary tract infections, and frankly, this is odd. This is one of the rare situations people are actually hoping they have an infection, because then they can take an antibiotic and the symptoms are going to go away. That's not what happens when people have a pelvic floor dysfunction that just manifests as irritated bladder symptoms. We need to help people become aware of the fact that the pelvic floor muscles can be a large contributing factor and that their bladder is actually the victim, not the cause. So when we look at the pelvic floor muscles, they are responsible for supporting the bladder, and the urethra also travels through the pelvic floor muscles. When these muscles become dysfunctional, they can compress the urethra, making people feel like they have to go to the bathroom when they do not, and they can also cause upward irritation of the bladder because the muscles support the bladder. They share similar innervation, and therefore these muscles are capable of producing symptoms such as urinary urgency, urinary frequency, and they can cause burning and pain during urination, rendering people feeling like they still have to go to the bathroom even after they stopped urinating. When I'm working with a patient in the clinic and there are impairments of the pelvic floor muscles, dysfunction on the pudendal nerve, I can palpate these different structures and recreate their symptoms of urinary urgency, frequency, and pain. This is often very validating for our patients because they finally have a reason for understanding why they have a bladder symptom without a bladder problem. And that is because these muscles and that pudendal nerve can create the same symptoms as a urinary tract infection or the symptoms that are characterized as interstitial cystitis. Interstitial cystitis can be a concerning diagnosis and scary as people start to undergo treatments. They may be treated by a urologist, they may be treated by a gynecologist, they may have been referred to a psychiatrist or to a pain management doctor. And without people actually understanding why they have these symptoms, it's going to be very stressful. What we really need to do is get away from the diagnosis of interstitial cystitis, which does not give us a roadmap to people's individual causes of their problem, and do a deeper dive into why each individual has these symptoms. It can be muscular, it can be related to nerves, it can be related to hormones, there can be a central pain disorder. All of these things are treatable, but without the proper investigation and differential diagnosis, many patients are getting bits and pieces of things that could be therapeutic, but it may not be in the right order and it may not be comprehensive enough. Pelvic floor physical therapy can take a look at all of these different areas and help patients get on the right pathway. People just need to know that the pelvic floor muscles can cause these bladder symptoms. A pelvic floor physical therapist can help you identify your underlying causes of your irritated bladder symptoms and can help you provide a roadmap to get you effective and comprehensive treatment so you can get relief. I've listed resources below of ways that you can find a pelvic floor physical therapist in your